Well, let's get you the latest now on the Ebola outbreak in the Democratic Republic of Congo. The World Health Organization says experimental vaccines are due to arrive in the town of Bikoro and surrounding areas this week. It's the epicentre of the outbreak. There are currently more than 30 suspected cases, with several confirmed so far. 10 African countries have put their health and border officials on alert in case the virus spreads. They include Uganda, Nigeria and Kenya. The spread of the virus is currently the biggest concern, especially for the Equateur provincial capital Mbandaka in the DRC. Well, let's get you more now on efforts to contain the Ebola outbreak in the DRC. I'm joined live from Geneva by Tarek Jasarovic. He is the spokesperson for the World Health Organization. Thank you for joining us, Tarek. First off, can you give us the latest on the number of suspected and confirmed cases of Ebola in the DRC, and has the death toll risen?
Well, from beginning of April until yesterday, there were 39 suspected Ebola cases. 2 of them were confirmed. 25 of them are considered as probable, and others are suspect cases. So we are still at 2 lab-confirmed individuals who are now known to be infected, but there are other testing that is taking place. What is really important right now is to get quickly to this area and put in place necessary measures. Our Director General, Dr. Tedros, was yesterday in Bikoro supporting the efforts of national health authorities and partners to make sure that we have enough of teams and material in place so we can do those containment measures.
Okay, well, let's talk about other measures. The WHO is sending experimental vaccines to Bikoro and the surrounding areas. How soon do you think these can be administered? And just how effective are they likely to be?
Well, we know that one of these vaccines is safe and efficient. It has been used at the later stages of West Africa Ebola outbreak. We are planning and making plans to use this vaccine in what we call a ring vaccination method. This is basically vaccinating contacts of people who have been in contact with someone who is being affected, and then their contact. So basically making a ring around the person who has been confirmed with Ebola. Also, health workers would be vaccinated too. It is a very complex operation. You have to remember that this vaccine has to be stored at between -60 and -80 degrees Celsius. And then can be used only for 2 weeks outside that temperature.
So
it will take some logistical efforts to bring those vaccines, and also first we have to identify who exactly has to be vaccinated. So it's not a general population vaccine; it is targeted vaccination. So we need to have those lists of people who are to be vaccinated.
Okay, as you say, that's a complex operation there. Experts in the DRC say it may take up to 4 months to contain the outbreak. Is the WHO prepared for that eventuality?
Well, we have to be prepared for all eventualities. We have learned that giving predictions and timeline, it's not really best thing to do. What is really the most important is to focus on the response. So, and we talked about vaccines, but vaccines are just one tool that we have at our disposal. Vaccines cannot replace all those standard measures, if you wish, that we need to have in place, such as epidemiological surveillance, such as treatment centers, so people who are sick are actually treated to increase their chances of survival. Contact tracing, as I mentioned, that we follow people who may have been exposed, safe burial practices. We also shipped over the weekend the mobile lab, so we can really quickly test people and know exactly who is infected with Ebola and who is not. And those measures all together are necessary to contain. We just need to do as fast as we can, but we know that this is area difficult to reach. We still don't know we still don't have full epidemiological picture, so we have to be prepared for any possibility.
So, well, apart from the DRC, there are 10 other African countries that have been put on alert following this outbreak. Is the WHO relying on local screening processes, or will you be sending monitors to those countries as a precautionary measure?
We are working with all neighboring countries. We have classified a risk of regional spread as moderate. It is important to know that people are moving, that Bikoro city is on the river, which is used as a transport route. So there is a risk of people going either through river or going to the provincial capital that you mentioned. So we have to be prepared for that. Countries in the region obviously are taking a close look to the situation. We are working them, we are informing them, we are checking their preparedness levels and see if we can help with that. It is important to know that for the time being, the World Health Organization is not recommending any travel restrictions. As always, Ebola, the best way to deal with Ebola is really to go to the heart of the outbreak and try to contain it there. But obviously, screening of people who are leaving affected area is something that can be considered, as it was done in 2014 in 3 West African countries.
Okay, Tarek Jarasovic there from the World Health Organization, thank you very much for your analysis.